Good afternoon, good morning, good evening, Salibunani, Ninjani. COVID-19 outbreak is not only a health issue, it goes beyond health. But perhaps the health response is one of those first responses that we need to get ready. I have prepared a few slides, and I would like Kosanna to be kind enough to place the second slide on the screen. So far here in our country, 438 tests have been performed. All tests so far have been done in the National Microbiology Reference Laboratory in the capital city of Harare. 11 specimens tested positive. And therefore we have so far 11 confirmed COVID cases in the country. 3 of these persons have unfortunately passed away. You may be interested in the geographical distribution of the cases. As of last Saturday, just less than a week ago, the first case here in Bulawayo was recorded, unfortunately a death. One of the very first cases in the country is a gentleman who returned from abroad to his home, Victoria Falls, that being situated in Matabeleland North. 4 cases have been reported in the province of Mashonaland East and the remaining 5 in Harare. So this is what has happened so far. What will happen next? What will happen during this long Easter weekend? What could be happening next week? That is described by a curve called the epidemic curve. And I'm sure in the newspapers and news reports we have seen those epidemic curves. They are simply graphic presentations of the number of cases reported and sometimes also the number of reported deaths by day, from the first day of the outbreak. The flatter the curve and the lower the curve, the less number of cases and deaths, the better, because it's suggestive of an outbreak that is manageable. If the epidemic curve looks very steep and the number of cases increases rapidly, sometimes the number of cases perhaps double in a few days, perhaps 3 to 4 days. That is suggestive of a bad curve, bad epidemic, bad pandemic, an outbreak which is actually out of control. And that is something that we here in Bulawayo would definitely wish to prevent, and it's something that we wouldn't like to see here. So a number of countries with perhaps epidemic curves that we would like to imitate, if we possibly can, could come from a country called South Korea or Germany. The curves that we wouldn't like to see in Zimbabwe and in Bulawayo are those curves currently recorded in Italy, Spain, and perhaps in New York State in United States of America. You may be asking, what are our chances that the outbreak will look different in our setting? Indeed, our populations are much younger than the populations, for example, in South Korea or in the European countries I have mentioned before. That is in our favor because all information so far is suggestive of the fact that this condition is mild, a very mild disease among children, adolescents, and young adults. It doesn't mean that they wouldn't get it, but it's an easier disease, it's a milder disease in these age groups. The fact that we have large rural areas where perhaps populations, our people do not live in a congested way is another plus in favor of Africa and in Zimbabwe in particular. Unfortunately, we have certain underlying conditions that have not been described, for example, among the patients in Wuhan, in China, and that is HIV infection. So this is an underlying condition which, in association with this COVID-19, where we will be learning the lessons and showing the way forward for the world. We also do have underprivileged areas where people living in underprivileged circumstances live. Luckily, we do not have shanty towns, we don't have slums, but we may have some informal settlements, and we definitely have high-density suburbs. I pray that all cities in Zimbabwe will have some water. It may not be sufficient water, but some water to observe hand hygiene in the weeks to come. Third slide, please. So some projections have been made, and here I want to mention Dr. Mark Dixon, who has played a pivotal role in thinking through what number of cases we may be facing here in Bulawayo. And we have looked at this using data from other countries so far. So the assumption is from the city fathers that our population would be approximately 1.2 million. Next slide, please. Here we have got a graph. I hope you can, or actually a table that hopefully you can see also at the back over there. Just some estimates, guesstimates, projections of total number of cases by week as the epidemic or the outbreak progresses from week 2 to week 6. And we didn't want to hazard a guess going beyond this approximately 1.5 weeks, 1.5 months. On the left-hand side in green is perhaps sort of a best case scenario, because if you look at the lowest row underneath the green sector of the table, you will see that the total number of cases is less than 50. And some of these persons would require hospital admission into an ordinary ward, and perhaps less than a handful would require ICU, intensive care unit, and ventilator care. Meaning that majority of persons, perhaps 80–85% of these individuals would have a very mild course of COVID. Some, perhaps 15%, moderate disease presentation, and only very few, perhaps 5%, a severe presentation. The worst case scenario is illustrated on the right-hand side in the red part of the table. You can see that if you add up the hospitalization in one way or another would be required by approximately 600 patients or persons. That's the sum of 364 and 196 individuals. And the total number of active cases reaching almost 3,000. So it would mean that we would need to have critical care, ICU level care for several hundreds of patients. Some sort of a middle way is depicted in yellow with a total of approximately 1,500 cases. And the classification or the distribution of cases with COVID remains the same in all three scenarios. Majority of people, luckily, fortunately for themselves and us, working in health, would be mild cases, perhaps even asymptomatic cases, and only 10, 15, maximum 20% would run a very moderate to severe course of the disease. Next slide, please. So here's an illustration of an epidemic curve. Is it going to be the orange line going steeply upwards, or are we going to be able to bend the curve? Ladies and gentlemen, I'm appealing to all of you to work hard and disseminate the messages which would be able and enable us to bend the curve. And the final slide is a summary of those measures that I'm appealing and I'm putting across to all of you this afternoon to follow through. And I think in this regard, Zimbabwe has already started the walk towards the prevention of the disease. We want to stop the community spread by effective physical distancing. I have avoided the term social distancing because I don't like it. And I don't think that we have to isolate or distance ourselves socially, socially, but we need to do it physically. And the illustration of that is the fact that we are sitting far apart from one another. We wouldn't usually sit such a distance apart from each other. But it doesn't mean that we wouldn't be able to keep in touch with one another. So there's no need for social distancing. Government level measures are in most of our countries called lockdown. Not shutdown, but lockdown, which means that a number of productive sectors of the society, unfortunately, are run at a low gear or at zero gear. Point number 2 is more health related, though of course we need the communities to see testing favorably for us to be ready for much more extensive testing in the country. That is of critical importance if we want to know the true magnitude of COVID among our communities. After testing, persons who test positive and who may be fairly well can be looked after through isolation and home care, symptomatic home care. And contacts of the confirmed cases would also need to be self-quarantined or provided facilities for this quarantine if it's not possible in our homes, and isolation is then reserved for persons who would be falling sick. And importantly, and I think Dr. Ndebele will come in next to talk about the readiness and preparedness of our health institutions and particularly our hospitals. Primary healthcare clinics, rural health centers will not play a role in providing the hospital level care during this outbreak. They will play an important role in detection of the cases, testing of the cases, and making sure that communities do have the accurate information available for this condition. So, as I mentioned earlier, luckily, majority of the persons with COVID will be managed through home care very successfully, and only those with moderate to severe disease will require hospital care that is likely to also require ventilator-level ICU care.
Basic information on COVID-19. 1. How can one tell if they suspect it? The case definitions are based on the current information available and will be revised as soon as new information accumulates. 2. Suspect case. A. A patient with acute respiratory illness, fever, and at least one sign or symptom of respiratory disease. For example, cough, shortness of breath, and a history of travel to or residence in a country or area or territory reporting local transmission of COVID-19 disease during the 14 days prior to symptom onset. Or B, a patient with any acute respiratory illness and having been in contact with a confirmed or probable COVID-19 case in the last 14 days prior to onset of symptoms. Or C, a patient with severe acute respiratory infection, fever, at least one sign or symptom of respiratory disease. For example, cough, shortness of breath, and requiring hospitalization, and with no other etiology that fully explains the clinical presentation. Confirmed case, a person with laboratory confirmation of COVID-19 infection, irrespective of clinical signs and symptoms. The City of Bulawayo Health Service Department, HSD, requires your cooperation and assistance in ensuring that suspected cases are diagnosed early and necessary infection control measures and contact tracing are followed to prevent the spread of the disease.